Hello and welcome to this My HCPC Standards webinar. My name is Kellie Green and I am the Professionalism and Upstream Regulation Lead at the Health and Care Professions Council. So today I'm going to explore some of the challenges to meeting professional standards while working in a pandemic. Very topical, how some professionals adapted their practice and the support that remains available to you today. But I wanted really to start with some congratulations. Congratulations to all of you amazing AHPs who have and will receive awards during this event. This is a great opportunity to celebrate and showcase all that you do. I also wanted to start with some thanks. A big thank you from all of us at the HCPC for what you have done this year. It has been particularly challenging, more challenging than usual, and we're truly grateful for the contribution that each of you have made towards the fight against COVID, as well as the delivery of your business as usual and the care that you give. So thank you very much from all of us at the HCPC. So thinking about this year, some of the particular challenges that have been faced, our policy team receive and respond to registered requests for advice on a range of topics relating to the standards. During the peak of the pandemic, the top three themes which we had requests for advice on were scope of practice, so concerns about the need for people to be working in different areas and in different ways. Managing risk, so this was requests for advice on managing the control of infection and access and use of PPE. Adapting practice, so working remotely, moving services online, as well as closing and reopening practices. The graph here shows the trend as we move through the pandemic timeline, and you can see that in March and April, lots of people were seeking advice from us on scope and managing risk. And then as we moved into May, we began to receive more queries around reopening of practices and trying to return to business as usual. In response to these requests for advice, we produced and published more specific information about meeting the standards at this time. We developed a COVID-19 hub that you can find on our website, and this houses all of the advice and material that we've produced during this time. And we also shared a lot of this stuff online using all the usual social media channels. Today, we're going to spend just a little bit more time exploring how you can meet some of these challenges in practice. Now, when we're asked for advice, we do quite often say that you will need to apply your professional judgment when making a decision and determining what it is to do or how you should react. So what do we mean by professional judgment? Well, it's when you apply your knowledge, skills and experience in a way that is informed by the professional standards, laws and local policies and procedures that govern your practice to develop an opinion or decision about what should be done. So as professionals, you're applying your professional judgment to a range of issues every day. Sometimes you can easily reach an opinion or decision, and other times it can be more difficult to decide what is the best and safest option. When it becomes difficult, there are a range of resources and people that can help you and support you, and we'll explore some of these as we go. Now, many of you will have been asked to work in different environments and in different ways in this last year. We've received lots of queries about whether that means really you're now being asked to work outside of your scope of practice. The standard of conduct, performance and ethics does place a requirement on you to work within the limits of your skills and knowledge. So you need to keep within your scope of practice. Now, your scope of practice is composed of all of the activities that you undertake within your professional role. It's limited to the areas in which you have the knowledge, skills and experience necessary to practice safely and effectively. Your scope of practice will be unique to you, so it's defined by your knowledge, skills and experience. And when you're asked to, or you're choosing to, work in an environment or undertake a role or task that are not traditionally part of your practice, consider whether what you're being asked or you're proposing to do is underpinned by your primary skills, knowledge and experience. Your standard of proficiency will inform your scope of practice, as well as your job description, employer policies, and any guidance issued by your professional body. So if what you're proposing to do is underpinned by your primary skills, knowledge and experience, it is probably within your scope, albeit that you may need to refresh that knowledge in order to undertake the role safely. If it's not underpinned by that, then you need to consider whether it is something that you could undertake safely if you received training, supervision or support. So even if a role is outside of what might be traditionally expected of your profession, this doesn't mean that it is outside of your scope of practice, if you have or can obtain the required skills and knowledge. So what's key is ensuring that you can perform the role or activity safely and effectively and legally. So if your employer has or is asking you to move into a new area or role that you do not feel you have the knowledge or skills required, we would expect you to receive training or support to ensure that you are still able to practice safely and effectively. Now, we can't compel employers to provide you with this training or support, but we can enable you to seek it and to decide not to do what you're being asked to do. Use your standards, the additional information we provide to support your position with your employer. Also call on your colleagues, unions and professional body for additional support and representation if necessary. Sharing stories. Excuse me. We have been capturing and sharing registrant stories about how they work in different ways, adapting and meeting different challenges this year. It's been quite common for operating department practitioners to be deployed to ITU and to care for patients with COVID. This is Stuart. Stuart is an operating department practitioner whose scope of practice changed during the pandemic. Prior to the pandemic, Stuart had been working as an agency ODP in private hospitals, and as the pandemic hit, he moved into the NHS as a locum, and he tells his story about working in ITU and caring for COVID positive patients. Now, the quotes on the right are from a recently qualified OTP who also found herself working in ICU. She talks about the training she received to support her changing scope of practice, which also included sessions on proning ICU patients, moving and handling and general ventilation, drug infusion and airway skills. Also basic skills such as mouth and personal care for COVID-19 patients. Whilst it was a frightening time, and she tells us it's a frightening time, this newly qualified OTP also speaks of the support that she received from her colleagues. So these stories we've been capturing to share these real life experiences of how your scope of practice may have changed during the pandemic. Also other things that people have needed to do during the pandemic. All of the stories can be found on our website in the COVID-19 Hub. If you're being asked to stretch your scope of practice, asking yourself these questions can help you determine whether what you're being asked to do is within your scope of practice and you can undertake the role actively, safely and effectively. So if you are being asked to undertake a role or activity that you determine is outside of your scope of practice and you are unable to complete the necessary training or receive the support you need to ensure that you can practice safely and effectively, you can refuse to do that role or activity. Some activities are protected by law, and so you should ensure that your registration status provide for you to undertake any function or activity that is restricted by law. Here we give the example of prescribing. Some activities, for some you may need different or additional registration, and again the example we give here is dentistry. You should ensure that your professional indemnity insurance covers any new activities or extension of your scope. So some of the support that's in place for you, all of our standards can be accessed on our website. Our COVID-19 hub provides specific advice on applying the standards whilst working in the pandemic, including advice on scope of practice. You can also read some of our blogs. We have one that's called Can I Do That? Thinking Through Your Scope of Practice. Again, all available on the website, and are really useful things to help you get to grips with the situation that we're in. Now, switching over really from scope of practice, we do know that many professionals are trying to maintain business as usual and continue to provide treatment and care whilst respecting the social distancing and infection control rules. We've got some guidance that we've produced, which is adapting your practice in the community, and this explains the factors to take into account when deciding whether to continue to practice. This is available in our COVID hub and on our website. The current government guidelines still require us to maintain social distancing and work from home where possible. We see the restrictions increasing and changing in a number of local areas now, so we're all in slightly different situations. These measures continue to have an impact on your practice. Providing your services online can be an effective way to keep in touch with your clients and your patients and to continue to care for them, even if that care has to be modified or limited for the time being. Your online services need to be provided safely and in line with your standards. So you still need to meet various requirements, so requirements around consent. Ensure that your client or your patient consents to the remote consultation, and this includes ensuring that they understand any limitations that this will place on your ability to complete your clinical assessments or treatment. The usual rules about capacity to consent still exist, and it may be that a person who has capacity in a face-to-face consultation could be more challenged in a remote consultation, so think carefully about the capacity to consent. Communication, need to ensure that the service you're using enables you to communicate clearly, so that's really that it's not affected by poor mobile Wi-Fi services. The need to ensure that your patient or their carer still receive the information they want and need remains. Keep to the same professional language that you would use in a formal face-to-face consultation. Confidentiality, you should ensure your system or the service that you're using is secure and that you're speaking to the patient themselves, or you have consent to speak to another person, their family member, for example. Ensure that the patient has or can move to a place that provides them with privacy. You know, some of us are living in very close quarters with others. We're surrounded perhaps by flatmates or family members. So for the patient, being able to move to a place of privacy is important. Ensure also that you are in a private place and you're not being overheard by your own housemates or family members. Record keeping, the requirements around record keeping also remain, and you should identify on the record that the consultation was carried out remotely. Now, if you cannot provide safely the care or treatment via remote services, then you should probably not proceed with this option. But I know lots and lots of people have found a way to achieve this and are managing it very well. So let's look at another story. This is Claire. Claire's an art therapist, and she has shared her story about moving a music therapy session online. The sessions she talks about are for people with dementia who are supported by family members and friends. Claire explains in her story that those who attended the therapy session have told them that when they are making music together, it's as if the dementia isn't there. It becomes a safe space, and the music can connect and support the interacting and communication between the person with dementia and their carer or family member or friend. So it was really important that these sessions didn't stop. Claire and, no doubt with her colleagues, was able to move online, and Claire tells her story about the challenges they need to overcome to achieve this. Claire also recognises that we've all been administering our own musical therapy. We've seen lots of lovely clips on social media from of healthcare professionals getting their message across, keeping their spirits up with music and dance. It's been good to see them. Now the challenges remain, don't they? We're not out of the woods yet. And I think the contribution that you as AHPs have and continue to make in the fight against COVID is immense. Not only is it your contribution towards the treatment and care of those with the virus who have become very ill, but also the testing of those who may have it, the psychological support for those whose lives have been turned upside down, the longer term rehabilitation needs for those recovering from it, and the need to continue those important business as usual activities, such as music therapy for dementia for patients and carers. We know you've done a lot. It's been a particularly challenging year, and we're really grateful. So keeping your spirits up, taking care of yourself is as important as ever. And before I finish, I want to just take a moment to talk about your health and well-being. So at the start of the pandemic, we published some wellbeing resources and launched a campaign, a wellbeing and social media campaign. Our wellbeing resources included blogs and information on developing resilience, managing stress, and some top tips to keep yourself well. We could signpost to mental health support providers, some already providing specific tools to support healthcare workers. An example of this is the MINDS Blue Light programme for ambulance staff. Now, as things developed, lots of mental health and wellbeing resources and support became available for all key workers, those working within and outside of the NHS. So our focus changed, and we began to spend our time really identifying those quality resources and promoting and signposting those for you. A huge range of resources now exist to support you if you need it. To help you navigate these, we've collected them on our website, and you can find them in the COVID-19 hub under Your Health and Wellbeing. Now, we are conscious that you may feel the pressure to keep working. There's pressure on all of you, your teams. You see patients that need your help and your care. But if your physical or mental health affects your performance or judgment, or could put others at risk, then you should stop working until you are well enough to return. Please do remember that it is okay to stop working, and that if you need support, please use one of the many resources that are now available to you. So we signpost here to some of the resources that you will no doubt be familiar with and hopefully are making some use of. Health Education and Improvement Wales have some really good quality tools on their website, and of course Health for Health Professionals Wales also provides support, resources and tools. You can also access support via Mind and the Samaritans. Now, I hope you've enjoyed this webinar, and if you have enjoyed it, please visit our website to register for future HCPC events. We are currently running a series of My HCPC Standard webinars, which explore each of the 10 standards in your standards of conduct, performance and ethics, and we hope you can join us for those. We do hope you enjoy the rest of your festival. Thank you very much for listening to us.